So, targeting iron metabolism in PV is really kind of a nascent field as far as, how can we exploit our body's regulation of iron to kind of better control and better manage this chronic malignancy that's driven by JAK2 mutation that leads to kind of the overproduction of red blood cells as well as systemic iron deficiency. And so, PV is in a unique state where you have iron deficiency, which most of the time is associated with anemia, but here it's actually associated with erythrocytosis. And so, typically, an iron deficiency, when there's anemia, your body downregulates hepcidin, which is your master regulator of iron. It sends iron into the bloodstream and delivers it to the bone marrow to make up or compensate for this anemia and make more red blood cells. But you certainly have a different thing going on with polycythemia vera. So the thought here is, well, can we mimic a high hepcidin state, upregulate hepcidin, or mimic it in the setting of agents like Rusfertide, decrease the delivery of iron to the bone marrow and thereby control this erythrocytosis through a mechanism that seems certainly preferable to phlebotomies, right? So draining blood from people repeatedly. So, I think this takes into understanding kind of how our body regulates iron, and it really relies on the fact that we really only have one channel, ferroportin, that is responsible for delivering iron into the bloodstream to make it available. And so it's something that we can capitalize on from that standpoint. I think, fortunately, there's also potential other implication in terms of improving disease-related symptoms, because we know that iron deficiency is something that comes at a cost. Whether or not you're anemic or not, patients suffer from many symptoms from iron deficiency, and a lot of these are vague, challenging symptoms that make it difficult to live kind of a normal life the way you'd like to. And so we've certainly seen evidence of that with the use of Rusfertide as well, as far as improving some symptoms related to the disease.